we've got her eye protection on. So the Optilight is an intense pulse light. It's not a laser, but it is a very bright light. So Gabby, who's recording this right now, thank you, Gabby, and I'm about to put my eye protection on, but she has eye protection on too. Cynthia has her eye protection on. We've already had her face nice and clean, and I've already applied some gel that is over the area that we're going to treat, which is basically from one side of the cheek all the way to the other, and we'll also treat over the nose of it. And so this way you can just kind of watch. And if you come in to have your IPL, your Optilight treatment done, you can kind of see what the process looks like. The strength of the light is based on skin type. And so we've already calculated the proper strength for Cynthia. She's a skin type 4. We've got everything ready to go, and we're going to just dive right in here. So Cynthia, I'm going to start over here on the left side. Here we go. And Cynthia, how does that feel so far?
That's good.
Can you describe the sensation for our audience?
You feel a little bit of pressure, very, very light, barely touching, and then nice and cool, and then the light, just a little flash of light.
The light is bright. So sometimes when people jump, it's not from the actual sensation of the Optilight. It's not from the sensation anyway. It's because the light is bright. Even with the light guards on, it's a bright light. So we're going to come over here on the other side of your nose. All right, and here we go. And then we're going to do 2 passes. So we're going to come back over here on the other side again. And if you want to, you can bring your own music. Or we can listen to it together. I like true crime documentaries. If we want to just kind of listen to those while we do this. All right. I'm going to put my instrument on standby. And then we are going to switch out the attachment that we use. To a more precision instrument that really lets me get towards the eyelid, really, really close to the lid. Okay. And this light isn't quite as bright as that first one, at least not to the patient. Back over here. And that takes care of Cynthia's dry eye Optilight treatment. So there are a few things we just want to keep in mind. So since we were using an intense pulse light, she will put on sunscreen when she leaves here today. We provide that here in the office. We also have everything you need to wash your face unless you want to bring your own cleanser. But we will provide her a very, very thick sunscreen. A little goes a long way. So that when she leaves here, her skin is nice and protected. We don't want to use any retinol or exfoliating kinds of ointments or creams on our skin for about 5 days after we have this procedure done. There are also some types of medications that make it where we might not want to do Optilight while you're on those. We would go through that all before you have your procedure done. But that, in a nutshell, is the Optilight treatment. Thank you, Cynthia.